Welcome to NCLEX Review on Basic Care and Comfort. This content falls under the Physiological Integrity category of the NCLEX PN test plan and accounts for around 7 to 13% of the total test content. Today we'll explore the foundational aspects of client care areas that affect comfort, function, and basic needs. The NCLEX test plan defines physiological integrity as where the nurse needs to assist in the promotion of physical health and well-being by providing care and comfort, reducing risk potential for clients, and assisting them with the management of health alterations. Additionally, for today, with basic care and comfort, we are going to examine where the nurse provides comfort to clients and assistance in the performance of activities of daily living. Assistive devices enhance client independence and safety. Let's break down some key types. Mobility aids like canes, walkers, and crutches require correct sizing and technique. For example, a cane should be used on the stronger side and move forward with the weaker leg. A walker should be placed one step ahead, not too far, to avoid falls. Feeding aids such as adaptive utensils or plate guards promote independence for those with tremors or coordination issues. Communication aids include touchpads, communication boards, or text-to-speech devices. These are essential for clients with neurological impairments like ALS or stroke. Nurses must also reinforce teaching on safe and correct usage. For both clients and untrained staff, this ensures that devices are used appropriately and prevent injury. The section on elimination focuses on recognizing and managing elimination needs, which include both urinary and bowel function. Clients at risk for impaired elimination can include those on opioids, diuretics, or those with dehydration. The nurse should monitor bowel sounds, ensuring there is no obstruction or ileus, especially in a post-surgical patient. Client care tasks can include catheter or wound irrigation using sterile or clean technique, skin care for incontinence, which can include frequent cleaning, use of barrier creams to prevent breakdown. Also, bladder and bowel management protocols, such as scheduled toileting or digital stimulation for a neurogenic bowel. A tip for NCLEX that you should know is when to report absent bowel sounds. Typically, if no sounds are heard for greater than 5 minutes per quadrant, this should be reported to the primary healthcare provider. Immobility can impact several body systems, including skin, lungs, gastrointestinal, cardiovascular, and musculoskeletal. It is important that we be able to identify signs and symptoms of venous insufficiency and intervene to promote venous return. This is where use of elastic stockings and sequential compression devices come into play. It is important that we ambulate and perform range of motion with our clients. Passive range of motion should be used for those clients that are unable to move themselves. However, it is important that we encourage active range of motion to help maintain muscle tone. Repositioning every 2 hours helps to prevent pressure injuries and supports lung expansion, preventing pneumonia. We should maintain body alignment, especially in clients with neurological deficits or spinal precautions. It's also important to provide assistive equipment like a trapeze bar or transfer boards when caring for clients who have mobility and immobility needs. Non-pharmacological comfort interventions are interventions that can provide comfort without the use of medications and are often more holistic in nature. One example is heat and cold therapy. Ice is typically used for inflammation, while heat is used for stiffness or soreness. Always monitor skin integrity and limit application of both to 15 to 20 minutes. Use of elevation can be used to reduce swelling and promote venous return. Remember RICE, R-I-C-E, rest, ice, compression, elevation. This is typically used for things such as sprains and strains. Alternative therapies can also be used as a non-pharmacological comfort intervention. Things such as music therapy can help to decrease anxiety and pain perception. Pet therapy also has benefits in dementia care. Massage and imagery are also techniques that can help to reduce sympathetic nervous system activity. Support of visual and hearing impairments with proper light, glasses, hearing aids, or interpreters can also be used. Remember, complementary therapies are in addition to, not replacements for standard care. Non-pharmacological comfort interventions also include assessing our patient's pain. These can include nonverbal signs of discomfort such as grimacing, restlessness, or guarding. We can also use standardized pain scales such as Wong-Baker faces or the FLAC scale that can be used for our nonverbal clients. We can also teach stress management such as deep breathing, guided imagery, or meditation. These things can empower our patients and encourage them to have control over their own comfort. We can reinforce palliative care choices such as discussing pain control, allowing our clients to be involved in their care, quality of life, and dignity. We should also monitor response to our interventions and adjust them accordingly. Nutrition and oral hydration supports healing, immunity, and energy. Watch for aspiration risk in clients with stroke, sedation, or swallowing difficulties. These clients should be kept NPO until cleared by the physician. Verify feeding tube placement by checking gastric pH or with X-ray per facility policy. Be sure to monitor for patency and check residuals. Monitor nutritional status with intake and output, calorie counts, lab values like albumin, and daily weights. Encourage independence in eating with the use of adaptive devices or hand-over-hand assistance. Be sure to reinforce special diets. Diabetics may need carb counting, while renal patients may need protein restriction. Remember to respect cultural preferences. An NCLEX tip: be alert to signs of malnutrition, like unintentional weight loss or delayed healing. Personal hygiene helps prevent infection and promote dignity. Be sure to learn a client's routine. A client may prefer evening showers or use of specific products. Assist with ADLs such as brushing teeth, toileting, or dressing. Remember to allow for independence and only assist if absolutely necessary. Provide site care for enteral tubes. Clean with sterile water or per the facility policy, and inspect for irritation or leakage. Use adaptive tools such as shower chairs, long-handled sponges, or non-slip mats. These tools can help clients maintain autonomy while keeping them safe. Cultural considerations: some clients may have modesty concerns. Offer same-gender caregivers if appropriate. Postmortem care. Postmortem care is not just for the client, but also for the loved ones. Be sure to follow cultural and spiritual preferences by asking families what's important to them. Clean the body respectfully. Remove lines and tubes unless an autopsy is being performed. Prepare the body for viewing. Position the hands, close the eyes and mouth, and apply a clean gown. Confirm identity and apply multiple ID bands to different areas of the body before transferring the patient to the morgue or to the funeral home. Rest and sleep is restorative and crucial for healing. Assess usual patterns of sleep in your client. Some clients may need more naps or use a CPAP. Cluster care to avoid overnight disturbances as appropriate. Control the environment by reducing noise, adjusting lighting, and offering comfort items like blankets or music. Avoid stimulants such as caffeine in the evening and schedule treatments outside rest areas as appropriate. Evidence shows that poor sleep worsens pain, mood, and immune response. Let's work through a case study that focuses on basic care and comfort. In this case scenario, we have a nurse who is caring for an 82-year-old client who resides in a long-term care facility. Go ahead and take a picture of this slide so you can refer to it as we move through the case. Some things to think about as you're looking at this slide. Long-term care residents often have multiple chronic conditions. Being 82 years old increases the risk for impaired mobility, nutrition, cognition, and skin integrity. Consider age-related physiological changes such as decreased GI motility, diminished thirst response, and sarcopenia. Here we begin with the first step of the clinical judgment measurement model, recognize cues. Our goal here is to separate relevant from irrelevant information. Please take a moment to pause the recording to review the client data and determine your answers. Let's review those answers. The relevant cues in this particular case scenario are coughing during meals, decreased skin turgor, BMI of 17.5, and refusal to eat meals. Let's look at each one in depth. Coughing during meals suggests impaired swallowing or aspiration risk. This is a safety concern and takes priority. Decreased skin turgor indicates possible dehydration. A BMI of 17.5 is classified as being underweight, which increases risk of malnutrition, skin breakdown, and impaired immunity. A refusal to eat meals is a behavioral cue that points toward poor nutritional intake, possible depression, dental problems, or an alteration in taste. Less relevant information is the osteoarthritis diagnosis, which is important but is a chronic managed condition and doesn't directly relate to the acute risks. A mechanical soft diet has already been implemented and not a problem cue, but rather a response to a problem. NCLEX tip: always prioritize acute and safety-related cues over chronic background diagnoses. Our next step in the clinical judgment measurement model is to analyze cues. For this scenario, we are going to take each of the client findings listed and specify if the finding is consistent with the disease process of constipation, aspiration, stomatitis, or skin breakdown. Each finding may support more than one disease process. Essentially, in this type of question, we are matching each client finding with potential complications. This is about interpreting what those cues mean in the context of nursing care. Please take a moment to pause the recording to review the client data and determine your answers. Let's review the answers. Here we can start with the client finding of cough during meals. This should match to aspiration. Swallowing difficulty can lead to aspiration pneumonia. Coughing during meals does not correlate to constipation, stomatitis, or dehydration. Next, let's look at dry mucous membranes. This matches to aspiration, stomatitis, and dehydration, but not to constipation. Dry mucous membranes can affect mouth and throat sensation, leading to potential aspiration. A dry mouth also places clients at risk for developing stomatitis, which can lead to malnutrition. Dry mucous membranes are an indicator of dehydration. Next is poor skin turgor. This correlates to dehydration, a classic assessment finding that indicates fluid volume deficit. Poor fluid intake correlates to constipation and dehydration, but not aspiration and stomatitis. Fluid intake is essential in keeping the body and its organs hydrated and functioning well. A lack of fluid can lead to dry stools and constipation. An NCLEX tip: the exam often tests your ability to connect physical cues to multiple potential problems. Always consider system-based implications. Next, we move to the third step of the clinical judgment measurement model, prioritize hypotheses. In this slide, we see a new set of data. We have orders that have been written and the results of those orders. Please take a picture of this slide for referencing on the following slides. After reviewing the client's laboratory results, we are asked to complete the following sentence by choosing from the list of options. This is an example of a drop-down rationale. We must determine that the client is at highest risk for which condition, as evidenced by what finding. After making your selections, the final sentence should read, "The client is at highest risk for dehydration as evidenced by poor fluid intake." You may be wondering why things like dry mucous membranes or poor skin turgor does not correlate to dehydration. Dry mucous membranes and poor skin turgor are actual findings of dehydration. Here we are just identifying a risk for something and what would be the potential cause for that risk. Therefore, poor fluid intake is what puts the patient at risk for dehydration. The next step of the clinical judgment measurement model is to generate solutions. Here we must take into account all of the data for our client and now determine if the following nursing interventions are indicated or contraindicated based on the client's current condition and assessment findings. When approaching these questions, we must think critically. Do these interventions help or harm based on the current client condition? Let's walk through each nursing interventions. The first one is to refer to speech therapy. This would be indicated to assess swallowing and making recommendations for nutritional and hydration support. Offer thin liquids through a straw. This is contraindicated. Liquids should be thickened to assist with swallowing and prevent aspiration. Provide pureed foods. This is indicated. Pureed foods are smooth and just thick enough to prevent the client from aspirating. Encourage 2,000 mL of fluids daily. This is contraindicated. This is not enough fluid to address the client's hydration. Educate the client about aspiration precautions. This is indicated. Clients and family members should be taught about aspiration precautions for home care. A rule of thumb is don't offer oral intake until aspiration risk is ruled out. Prioritize consults and safety measures first. Our next step in the clinical judgment measurement model is to take action. Here we have a drag and drop item. We must drag words from the choices in the box to fill in each blank in the following sentence. It is important in this item that we prioritize the actions. Here we see that the nurse should first assess gag reflex. This ensures safe swallowing and prevention of aspiration. Next, we must initiate IV fluids. This will help to correct the dehydration and improve perfusion. And finally, we can offer thickened liquids. This is only safe after the gag reflex has been assessed. NCLEX testing tip. Actions must follow assessment, planning, intervention, and evaluation. Never intervene before assessing safety. Our last step of the clinical judgment measurement model is to evaluate outcomes. In this particular scenario question, we are to identify which two client findings indicate that the nursing interventions have been effective. This is what we call a select-in response. It is similar to a SATA, except it tells you exactly how many answer options you are to select. Let's walk through our answer options. Let's start with the correct answers. The client coughing with meals has decreased. This is an improvement in the client's condition and will contribute to improved oral intake. Urine output is at 300 mL in an 8-hour shift. This is a correct response. 30 mL per hour is the minimum urine output that should be seen in a client. This client has 37.5 mL per hour and indicates good urine output and an improvement in their hydration status. These correct options reflect improved hydration and decreased risk aspiration, and that your interventions are working. Let's look at the incorrect responses. The client states they still feel fatigued. We want to see the client's activity level return to normal as the nutrition and hydration problems are corrected. Tinting of the skin turgor. This indicates an ongoing dehydration. Calcium level of 8.8. This is not directly related to the primary nursing goals that were identified or problems indicated for the client. An outcome evaluation tip. Focus on functional improvements and symptom relief. Ask yourself, what has changed for the better based on what I did? Thanks for joining this session. You now have a solid grasp of basic care and comfort for the NCLEX. Please reach out if you have any questions or need resources. Let's help you succeed because safe, compassionate nursing starts with mastering the basics.